If you're treating inflammation with medications and supplements but still struggle with symptoms of inflammation, you may need to address blood sugar dysfunction first before you can heal and recover. In this video, you'll discover a functional medicine approach to first identify the symptoms and the root causes. This is Dr. Peter Kahn. I'm a board-certified chiropractic neurologist and board-certified in integrative medicine. Let me show you how to master your health. Now, this is part 3 of a 3-part series on blood sugar as the underlying cause of inflammation. You can watch part 1 and 2 on my channel, which will really help you understand why this is where you want to start if you want to improve your brain function, metabolism, and reduce inflammation. Now, blood sugar imbalance has huge impacts on neuro and metabolic health. Glucose is your brain's preferred source of fuel. It is a quick source of fuel during glycolysis for short-term, high-intensity activity. But that doesn't mean that you should be eating sugar to improve your brain function or metabolism. On the contrary, excessive consumption of simple sugar and refined carbs is exactly what leads to blood sugar to be dysfunctional in the first place. Now, there are 2 main flavors of blood sugar dysfunction: hypoglycemia and insulin resistance. One is where your blood sugar level tanks and your body has lost the ability to balance out your blood sugar, resulting in symptoms such as feeling lightheaded, shaky, irritable, feeling worse when you skip meals, and feeling hangry. The other is insulin resistance, which is caused by chronic high blood sugar levels, usually caused by lifestyle choices, leading to chronic high insulin secretion, which leads to your cells becoming resistant to the action of insulin. When that happens, glucose cannot be transported into your cells to be used for energy, so you end up with high blood sugar, which is a mechanism of type 2 diabetes. The resultant symptoms are weight gain, slow metabolism, fatigue after meals, and hormone imbalance. Now, both hypoglycemia and insulin resistance leads to inflammation and eventual neuro and metabolic dysfunction. Many people, maybe you watching this, struggle with chronic inflammation and or autoimmune disease and are constantly looking for ways to reduce inflammation, perhaps with medications or supplements. Now, from my experience, if you don't address this foundational problem of blood sugar dysfunction, your efforts to dampen inflammation will be ineffective. To solve blood sugar problems, you need a proven game plan. So you can see that blood sugar causes more than just metabolism problem and sweet cravings. It can cause brain problems, it can cause inflammation, autoimmunity, and hormone imbalance. So it's something that's such a common problem, but it's also a relatively easy problem to fix. So let's talk about how to fix it. So here's the approach to solve blood sugar problems. First, you want to identify whether you have a hypoglycemic pattern or insulin resistant pattern. One way you can do that is by using the symptoms, right? If you identify with feeling worse when you don't eat and you feel better after you eat, your brain symptoms relieve after you eat, that might indicate that you have hypoglycemia. If you're a thin, lanky type, thin and lanky body, right, skinnier people tend to be more hypoglycemic. So there's some body type association here. The insulin resistant, the cardinal feature here is fatigue after meals, sweet cravings that does not subside, and then also tend to have weight problems. These people tend to be more substantial body type, right, more bigger bone person rather than a thin and lanky. Now, that's not always the case, but that's something we look for. So you can use symptoms to tell you whether you're reactive hypoglycemia or insulin resistant. Now, here's a kicker. You can have both. It's like, Dr. Kahn, what if I have symptoms in both categories? I have all of these in both sides. What does that mean? Low and high. No, that means that you have reactive hypoglycemia, but also insulin resistance. Remember, low blood sugar results in insulin surges, which cause both. So you can be a mixed type of having both. So we need to identify what type you are, because if you're just on this category, the thin, lanky, and shaky, lightheaded, irritable, if you don't eat, then you would do one specific thing. If you're the obesity, overweight, can't lose weight, fatigue after meal, very insulin resistant pattern, then you'll do a different set of things. If you're a mixed pattern, then you may start at the same point, but eventually, based on your presentation, we might do different things. So the first step is identify what pattern of blood sugar dysfunction you have. And then we want to identify what's the cause of that blood sugar dysfunction. Is it a lifestyle issue? right? Are you choosing to skip meal? Are you choosing to eat sugary snacks? Are you choosing to overtrain, right? We can help you to make those choices. So we make lifestyle choice changes with you. That's what we do in our practice when we help with our clients. Now, sometimes though, it's not just simply a lifestyle problem. There's some type of organic issue or what I call neurometabolic imbalances. Neurometabolic imbalances are imbalances within your brain and your metabolism that can be caused by infections. And infections can be bacteria, viruses, candida, parasites, mold. You can have environmental toxin exposure, like from plastic, fire retardant material, BPAs, and heavy metals. You can have food sensitivities that are unbeknownst to you. So you may need to identify what food you're sensitive to. You may have leaky gut, and I will even add to that leaky brain, or any barrier problem. Leaky brain. So what's leaky brain? If you're not familiar with that, leaky brain means leaky blood-brain barrier. So your gut has a lining that keeps the food in the tube of your GI tract so you can eliminate on the other end. That lining has a similar tissue to your blood vessels that supply blood to your brain. And that blood vessel that supplies blood to your brain has a lining that keeps certain stuff out and lets certain stuff through. And that's to protect the brain, so not just any chemical and toxin can get into the brain. If you have damaged blood-brain barrier, those blood vessels that supply blood to the brain is damaged to some degree, then things that normally doesn't get into the brain can get into the brain, and that can drive inflammation in the brain, which then drives inflammation in the gut, and leaky gut can cause more leaky brain, so that becomes a vicious cycle of inflammation. And all of these all causes chronic inflammation systemically, right? And then chronic inflammation is what we're looking at here with NF-kappa B. And blood sugar could be something that can feed that inflammation. So if you're already inflamed from leaky gut, leaky brain, food sensitivity, toxins, infections, all you got to do is just add blood sugar problem to that, and you're going to cause a chronic issue that's going to be very difficult to resolve. And oftentimes, fixing the blood sugar problem is the first step before we even tackle these problems. See, many people want to go straight to, oh, I have candida, I have SIBO, I need to fix that first. Or I have, some kind of chronic toxin exposure, I need to fix that first. Well, sometimes fixing the blood sugar first will help you to be able to get rid of infection better, help you to be able to get rid of toxins better. So there's an order in which we do things, and blood sugar is a foundational step, something you do first. And all these chronic inflammation can drive autoimmune, but autoimmune itself can also drive blood sugar imbalance. Because this pattern here, with this inflammation, this is going to cause elevations in cortisol. When you have inflammation, your body pumps out cortisol, which is an anti-inflammatory hormone your body naturally produces. When you increase cortisol, cortisol has the effect of raising blood sugar. So what that means is simply by being inflamed, you can have high blood sugar, even if your diet is perfect. I have a lot of clients who come to me, they're like, man, I'm already eating so clean, I exercise, I do everything right, yet I'm still inflamed. And that could be, or they're eating perfect, but they still have high blood sugar and they can't lose weight. That could be because the inflammation is driving cortisol, driving the high blood sugar. So autoimmune can be a cause to blood sugar problem. And then adrenal stress. Anything that can stress the adrenals can cause blood sugar imbalance. So what are some of these things that can cause stress to the adrenals? Lifestyle, right? All these things that you're doing here can all stress the adrenals, right? One thing that's not on here is actually just stress itself. You're stressed out about your job, stressed about your relationship. That is going to stress the adrenals, and that can cause blood sugar issues. Despite you eating perfect, if you eat perfect, you still have blood sugar problem. These are the list of things that we look for. Okay? And these things usually are identified through either lab test or a detailed history, working with a qualified, knowledgeable, and experienced functional medicine practitioner who can look at the root cause. So a combination of very detailed lab work, functional medicine lab work, as well as detailed history to put the picture together. And not only that, once we identify, because some people have more than one thing, and most people, by the way, have more than one thing. You may have various infections and different toxin exposure and food sensitivity and leaky gut and chronic inflammation and autoimmune. You may have one of everything here. The question is, which one do you address first? That's the key question. And blood sugar, I will say that is one of those things that you want to look at first. Okay? So this helps you to understand that blood sugar problem can be caused by lifestyle choices, but can be also caused by various underlying root causes that can drive blood sugar problem. But once you have blood sugar problem, you're going to decrease fuel to brain, which may decrease your ability to dampen inflammation. And high blood sugar drives insulin resistance, which drive high blood sugar, high A1C, high DAMPs, which all drive inflammation, which at the end can create autoimmune tissue destruction or autoimmune flare-up, or start an autoimmune disease if you don't already have it. And then inflammation can also increase cortisol, which is stress hormone, which can increase blood sugar as well. Hope that helps you understand how important blood sugar stabilization is. And that's just one of the many things that you need to address on the way to improving autoimmunity. See, blood sugar is just one of the many root causes that you need to address, but it also is one of the beginning steps of helping you to stabilize the foundation of your body, your metabolism, so you can actually produce energy to carry out detox, to help your body fight infection, to heal leaky gut. So hopefully this helps you to prioritize, and I'll see you in the next video. I hope you see the importance of regulating your blood sugar in dampening inflammation and controlling autoimmunity. Please let me know in the comments section what is the one big takeaway you learned from this video, or new revelation. I love to hear from you, and I respond personally. Now, if this video helped you, please like the video and share with others so they can get help too. Please subscribe to my channel if you have not already done so, and get notified when I release new videos. God bless you, and see you in the next video.